Well, good morning to everybody joining us for SSIS Targeted Case Management Tips and Tricks, a recipe for success. Today we're going to do something a little bit different, and we're going to have a hard start to the meeting rather than waiting that 2 to 3 minutes because we have an action-packed presentation for everyone. Today's webinar places a strong focus on SSIS data entry. However, we do have elements of policy sprinkled throughout this presentation. Before we get started, I want to extend a sincere thank you to Casey Volkers. Casey is a staff accountant for 9 years and also a fiscal mentor with Stearns County. Casey provided the framework for this webinar and contributed an incredible depth of experience that shaped the content you'll see today. This presentation truly wouldn't be possible without that groundwork. And also thank you to Heidi for coordinating the webinar. And I also want to thank our subject matter expert, Carrie Kaiser, and policy experts, Jolyn Sundstrom with Child Welfare Targeted Case Management, and Jennifer Rose with Children's Mental Health and Adult Mental Health Targeted Case Management, who reviewed materials, offered guidance, and helped ensure the information we're sharing is accurate, clear, and practical. Your input strengthens this training and supports the work of everyone here. Our policy partners that represent VADD TCM and RSC TCM could not make it to today's presentation. However, we have contact information for these groups to refer policy-related questions to toward the end of this presentation. We appreciate all you do and all the work, and we're excited to share some tools and insights that we hope will make a meaningful difference in your daily practice. Today's agenda is we're going to start with some housekeeping. Then we're going to move into progress on our SSIS data cleanup initiative. We are also going to cover some CP placement basics training that's coming up. We're going to announce our mentor of the month. We're also going to announce something that sort of slid in at the last moment here. We have a couple of job postings that we'll go over with everybody. And then we'll hit the presentation. I just want to let everybody know that we could very well run over our time this morning. We have a stop time of 10:30. However, due to the action-packed nature of this presentation and some questions that might come in, we are willing to run a little long. If people have to excuse themselves, we will post the full recording with our Minnesota Child Welfare Training Academy partners. A little housekeeping. Attendees have been muted upon entry. To speak, you can raise your hand and we'll go ahead and unmute you. Also, we have a Q&A feature or a chat feature where you can submit questions to our staff. Closed captioning can be enabled using the closed captioning button. And this session, again, is being recorded and will be posted on the Minnesota Child Welfare Training Academy website in 7 to 10 business days. The next thing we're going to do is just review that Tennyson warning before we jump into the remainder of the presentation. We'll go ahead and have everybody take a look at this and give you a minute or two, and then we'll jump back in. All right, folks. Next up, we have Marcia Riss with our modernization team to provide an update on the SSIS data cleanup efforts.
Great, thanks, Eric. Good morning, I'm Marcia Riss, the SSIS Modernization Strategy, Quality, and Product Manager. Here's a quick progress update on two of our ongoing cleanup areas, clearing and intakes needing action. As you can see in the dials on the right of the slide, we're now at more than 46% reduction in our clearing totals across the state and a nearly 50% reduction in intakes needing action backlogs statewide. This was as of yesterday. These are really significant improvements and reflect real consistent efforts across the state. One of the most encouraging parts so far is that more than half of agencies are showing measurable improvements. And that really tells us that this isn't an isolated effort of a couple of agencies with really large backlogs. The momentum is really happening broadly, and agencies are engaging in the work fairly consistently. Thank you for continuing to move this forward. These improvements make a tangible difference in our statewide data quality and help set us up for success as we move toward a new SSIS system. Next, we're going to talk about the new focus area for the month of July. To build on the strong progress from the last couple of months, July brings a new cleanup priority, and we're going to focus on unassigned intakes and unassigned work groups. So this focus area is important because unassigned items can create gaps in worker history and increase the chance that key steps in the workflow stall and don't move forward as timely as expected, which can lead to clients getting left behind. Addressing these unassigned items helps ensure that information flows smoothly and timely from intake to assessment to case management. Cleaning up unassigned intakes and unassigned work groups also supports accurate worker timelines, which become especially valuable as we prepare for SSIS mapping and conversion. When items sit unassigned for long periods, it complicates both the workflow and statewide data readiness. So building good habits now to avoid these types of backlogs will help ensure that we have less issues later when we're transitioning cases. Right now, we're starting with a baseline of about 1,500 unassigned intakes and work groups statewide as of yesterday, all open more than 30 days. So this gives us a pretty strong starting point to measure improvement as agencies work through this new priority. Next slide. As we build on the momentum from our current cleanup priorities, we also want to look ahead to the next set of areas that we'll be focusing on. So some agencies are ahead of schedule, maybe don't have much to clean up thus far or have already cleaned up their items. So just going to give you a peek of what's coming up. So the upcoming efforts remain aimed at strengthening system accuracy, improving workflow reliability, and preparing us for SSIS data transitions. Oops, yep. Thank you. Stay there. One of the first areas that we'll move into later this summer is inactive staff access cleanup. So right now there are more than 4,000 users who currently have active SSIS roles in SSIS, but haven't logged in for over 90 days or more. Cleaning up any inactive accounts will support better security and ensure role assignments reflect actual system use. We also plan to focus on open work groups with no recent activity, starting with those that haven't had notes or time recording actions in the past 12 months. Closing out or appropriately updating these work groups helps ensure open cases accurately represent active work. We'll look at many of the data integrity reports located in the data integrity folder under SSIS general reports, and many of these focus on demographic type info. Such as clearing, so as clearing is cleaned up, many of these will see reductions coincide with clearing cleanup, which is why we began with the clearing rather than the data integrity reports themselves. We're also planning to review business organization records, so BizOrgs, especially for family foster care providers to ensure licenses and physical address information are complete and up to date as well. These upcoming focus areas will help us continue improving data quality statewide and keep us well positioned as SSIS work progresses. Of note, other than the staff access cleanup item, the other efforts listed may not be in that order that we proceed with. So stay tuned and check out our sentiment and feedback page for more details and updates. We post on there about every 2 weeks with either an update or new information on the next rollout data cleanup effort. So that's what I have for you. Thank you.
Hey, Marcia, there's a question for staff access. Do we delete the county workers who have requested access in the ZZDHS staff?
No, you won't be able to to delete any DHS staff, and county workers, that those are not things that you'll actually have access to delete. Those are statewide approved items generally, so you won't have access to delete those once they've been approved. So you're just focused on persons that you have given access to. Hope that helps.
Thanks, Marcia.
Yeah.
There's also a question about the handout. I had posted that on the Engagement HQ or Sentiment and Feedback site, but it's not working for me to paste. But I'm wondering if Heidi could go and grab that link and throw it into the chat for me, so that people have access.
Oh, I just put which one are you talking about?
You
Sorry,
did.
Heidi.
Yeah,
I put the one
that's
for
what I was going
sentiment and feedback. Yeah, I put the one pertaining to the data cleanup efforts, the sentiment and feedback, but I'm not sure if that's the one you're talking about.
I think they were referring to the presentation today. So if Heidi, if you could post that in the chat, that would be great.
If you go to the sentiments and feedback page and scroll down, you'll come across the one that says June 30th. TCM tips and tricks. And I did put a link to the presentation there as well. So try that. And if that does not work, let me know and I'll go back in again.
Thanks. All right, next up on the agenda is a quick announcement about the CP Basics Placement Basics training. The SSIS 400A SSIS CP Basics Placement Basics training is a 2-hour training that follows the permanency folder entries for a child in an out-of-home placement. And it's also followed by what we call SSIS CP 401, which is CP Basics Placement Basics Self-Guided Practice Clinic to help users get used to the data entry in our training environment. We do encourage folks to take the SSIS Child Protection Permanency online training on our SSIS resource page or sentiment and feedback page. You can access those online modules prior to taking the clinic. To register for this course, you would navigate to TrainLink, Children's Services, upcoming webinars and live training, all SSIS content, and then select the Placement Basics training from there. There are also instructions on the SSIS resource page on how to sign up for those classes. And then one more quick announcement. The SSIS Business Operations team is hiring for 2 child welfare subject matter expert positions. And interested parties will want to navigate to search jobs careers in the state of Minnesota. Select search for jobs now and use job ID 95168. This position serves as a key bridge between child welfare policy, local agency practice, and technology implementation with the SSIS environment, and the role ensures that system functionality aligns with federal and state policy requirements and supports local agency operations through collaborative, agile, and user-centered development. Individuals with questions regarding these 2 child welfare subject matter expert positions can reach out to Erica Jepson for more details. And next up, we have Heidi with the Mentor of the Month.
Well, thank you, Eric, and good morning, everybody. I am excited to announce this month's Mentor of the Month. It is Suzanne Whipperling from Cass County. And per Lacey Haig, Sue goes above and beyond on a daily basis, helping others with SSIS and keeping up to date on what's new. She helps others with patience and kindness, and she truly keeps things moving smoothly at Cass County for the 7 years she has been with us. She takes on new projects without complaint and is everything we could ask for in a SSIS mentor. We are so thankful for her. And we are also grateful for Suze. So Suze, thank you for all you do as mentor. We do appreciate you so much. And if you have somebody that you would like to nominate for the Mentor of the Month, please feel free to send me an email. I will put my email address in the chat, and I look forward to hearing from you. And I hope all of you have a really good day and a fun and safe 4th of July holiday coming up.
All right, thanks, Heidi, and congratulations, Suze. All right, without further ado, before we dive into the SSIS targeted case management tips and tricks, I'd like to start with something we can all appreciate: chocolate chip cookies. Because honestly, creating a clean, accurate TCM claim batch in SSIS is a lot like baking the perfect batch of cookies. So again, without further ado, Chef Staff Accountant Casey Volkers is going to provide that recipe for success. Over to you, Casey.
Alrighty. Good morning, everyone. So again, my name is Casey. I've worked with Stearns County now for 9 years. Please let me know if you can hear me okay. I think I can be heard okay, and if I need to adjust my volume, I will go up or down. So,
You're good. You're
so
good.
I think what we're gonna do right now, let's just start at claiming starts with SSIS time entry. So we can go ahead and go to the next screen. So this screen talks about having a model and sell it. So all agency employees must be fiscally responsible to keep the county levy at a minimum. Um, what does this mean? The more revenue and less expenses, more efficient processes which save time, working together across divisions, contributing to a positive work culture, supporting diversity and people of all backgrounds and cultures to keep staff turnover at a minimum. Um, Staff turnover overall has a negative impact on revenues based on them leaving the SSTS time study and not be able to select a random moment until of the following quarter after they're hired. And then even with the accounting unit, when someone leaves their position, their knowledge walks out the door. And when you bring someone in, you have to work with them to get that knowledge back. Um, this motto has been something that we've really pushed forward with Stern since 2018, and it allows us to always something to fall back on and something we utilize in everything we work towards. In addition, we conduct some financial analysis and forecasting to identify the financial concerns, which involves evaluating financial risks when innovative ideas are introduced, and then monitor and measure goals to make sure they are working like they should be. And we can go to the next slide, please. So SSIS time entry equals county revenue. So this slide talks about how SSIS time entry funds case managers and social worker positions. This revenue may be used to maintain or expand preventative services. Um, when you're entering your time entry in SSIS, they should be attached to a work group whenever is possible so it counts as program time. And all this is including reporting documentation, case coordination, research, and correspondence. Stearns County has the expectation that 85% of case managers' time is program time when after you exclude PTO and breaks. The time entry documentation helps in courts. In division, time entry can make or break a child protection case. Um, and also having all this information in SSIS enhances our delivery quality because all workers involved have access to the same information, what has been done to avoid any duplication that's already been done prior. It shows a better history of what has been done and what works with a certain family or client. And at the end of the day, SSIS time entry gives you credit for the work that's being done. If it's not in the system, it's like it never really happened. And we can go to the next slide, please. So the value of TCM. So we got five cookies here that show you that when you're entering, the more SSIS time entered gives you the potential for more revenue, the ability to serve more clients, potential of more staff hired, and the ability to manage your caseload sizes to make them more accessible for staff on a daily basis. And we can go to the next slide, please. The key ingredients to claiming. So the case manager qualifications, also known as the staff qualifications. In addition, we have the eligible staff time records, supplemental eligibility, medical assistance or Minnesota care eligibility, diagnosis codes, and then the staff provided rates for either CW, CMH, BADD, TCM. So that's child welfare, children's mental health, vulnerable adults with developmental disability. I will go in between saying the abbreviations and the full readouts throughout this presentation, just so everyone's aware. We can go to the next slide, please. So this slide is, we're on the first ingredient of our cookie. So we're going to start with the case manager qualifications, also known as the staff qualifications. If you want to make sure your case managers are social workers, are hired with the proper qualifications, you'll want to refer to Minnesota statutes. So this page right here shows the SSIS admin screen that shows access who oversees the updates and additions in SSIS. Kind of like keeping everyone's credentials in check, federal and state policy requires agency verify when staff are eligible to provide services and claim reimbursements for the services. When staff move from one area to another, the qualifications should be reviewed and updated. Here at Stearns, that is something that's happening all the time. That staff move around, staff go from one position to another, their qualifications and their workloads changes. We can go to the next slide, please. So this is my first stop for questions. There's a total of 5 question sections. So if there's any questions I can help with right now, I'll do my very best. If not, we'll go to the next section.
I don't have any questions as of yet, so we can probably move forward.
Perfect. That'll work for me. We can go to the next slide. So we are on the second ingredient, eligible staff activity time record and SSIS. We can go to the next slide. So this slide shows the chronology section and kind of a screenshot of a time entry section in SSIS. The chronology folder is a location to where documents of various actions can be held by the agency in service to the workgroup participants. Workers create different types of records such as case notes, documentation, reports, contacts, activities, documents, and attached files. Workers mostly use chronology in assessment and case management workgroups, although some program types allow for chronology to be used in intake workgroups such as adult protection services. This is the time entry screen case managers see. Next, we'll go into the pieces needed to create a claim with the time entry. On this page, there is a link to the chronology. There's a link to the chronology on SSIS link page, and this takes you to a list of other trainings that are available and documentations on TrainLink. We can go to the next slide, please. So this slide talks about contact, activity, claimable, brass service codes. We have just a simple list of these brass codes that are able to be selected. Each of the labels, the CW TCM, CMH TCM, VADD TCM, and AMH TCM, have links that you can click on that should take you to the provider manual that discusses that particular type of targeted case management. This is a resource that I use all the time when I'm working with claiming to better understand the situation when I am having discussions on the C of edit that's in SSIS and just communicating with a social worker or case manager. We do a couple additional checks, which seems like may be a lot of extra work, but generating revenue is always worth the extra time. The two of these are, the first one is looking into brass code 492. That is for child general case management. And we look at that brass code to see if there's potential time entries that could have been coded to brass code 490, child rule 79 case management. And then we also look at brass code 493, adult general case management, to see if it's possible that it could have been selected as 491 adult rule 79 case management. We also investigate waiver edits to see if there are possibly VADD TCM. All of these items are things that we research as an accounting unit in Stearns County, and then we'll take that information that we are able to research and we follow up with the case manager and social worker to see, just to verify the time entry is accurate, just so that so everyone's at the same understanding. At the end of the day, the case managers are the experts on the case, and we, as us as a staff accountant in our accounting unit, just want to verify the information just so we understand what was selected. I'm going to touch a little base on a couple of the brass codes in the CWTCM section. Brass code 107, child welfare assessment, and brass code 109, concurrent planning assessment. And any assessment before opening case is a non-covered service. These assessments are a part of determining if the child meets one of the criteria for eligibility to receive CW services. And we can go to the next slide, please. All right. This slide talks about the contact activity claimable, what's claimable. Here are the valid activities for TCM. 60 plus miles from the county border is allowed for CW TCM, phone or interactive video contact when the client is 60 miles away from the county border. You can have 2 of these contacts in a row, but there must be a face-to-face every 3 months. And that was specifically for children's welfare targeted case management only. Technically, a collateral contact, which is listed under CWTCM, is an option that is claimable, but a face-to-face client contact is required in the same month to create a claim. You would notice when the claim is created, the time entries will be kind of grouped together, and the client contact and collateral contact will all be together in that case. And we can go to the next slide, please. All right. Contact activity claimable, contact status. So the regarding section is a section in the time entry that can cause a lot of edits if case managers do not select the correct client. SSIS tries to create a claim for each person selecting in the regarding section. They should only select the clients that a visit is regarding, and if all others would be selected in the contact with field in the time entry section. And let's see, and then those, if you're trying to create a claim, the clients in the regarding section would need to have a supplemental eligibility, active medical assistance, and if it's like a mental health TCM client, they need to have an MH diagnosis selected. Lastly, the contact status must be completed. Attempted creates a proofing edit and not a claim. We do review attempted status is just to verify, just to make sure that it just wasn't a misclick by the worker. One question we received prior to the presentation is how many minutes are needed to create a claim when multiple eligible clients are selected in the regarding section. Personally, this is a question I didn't have an answer to until I reached out to the help desk and the team here. After researching this, it was determined that a minimum of 8 minutes of time per child was needed to create a claim. We can go to the next slide, please. The contact activity claimable contact methods. So first, I'd like to just bring up that, and it says it at the bottom, that counties must have a TCM provider assurance statement 8398 on their provider file for interactive video services. Interactive video is not claimable for CW or children's mental health child in an out-of-home placement or receiving TCM for child protection reasons. This form is a form that you fill out. You just have to fill out one time and you should be good. And it was something that was back in 2023. So I would safely guess that most counties, if they want to utilize this, have completed the form already. Interactive video has the same service thresholds, reimbursement rates, and authorizations required as an in-person service. One exception with the interactive video and not being claimable for CW or CMH in an out-of-home placement is if the child is placed more than 60 miles beyond the county or reservation borders, then an interactive video is claimable for up to 2 consecutive months. But you still will need that third every 3 month face-to-face. At Stearns here, we tried to we make it not a requirement, I will say, but it's highly suggested that everything is done face to face and that an interactive video is a fallback option based on the case. That just makes everything works easier for us. When you are running your edits for children's mental health, you will also see these edits related to the interactive video is not claimable in an out-of-home placement or receiving TCM for child protection reasons, and that's just strictly just because they don't have the option, is the 60-mile option as well. So that's where those can come up. And I also want to make a point that email or text message cannot substitute for a telephone or interactive video contact. There was a bulletin that we had utilized that everyone received back in 2024, Bulletin 246804, that talked about the child welfare target case management. Page 5 and 6 has some great details on that, and a link to that bulletin will be on the spreadsheet. I believe it should be on slide 52. It's at the very end of the presentation with some other great links for help in the future. We can go to the next slide, please. All right, so here's our second set of questions.
We have some questions.
Yep.
I'm trying to find the beginning here. Okay, as far as the presentation link, I updated that link, so I'm hoping it works. I did post that. Emmy Lou also posted it in the chat, so go ahead and try that, and if it doesn't work, let me know. Somebody is saying, I was always told that child protection investigations and assessments could not claim CWTCM. Do we need to add a clarifying point on that?
The assessment part is not eligible for CWTCM. So most of the time in those roles, from just experience and just clarification I've received in my role, those workers are like the first stop in meeting with the case and are starting to begin to get the information, see if they qualify, and kind of get things ready for like in a protective hearing. And we do have information in upcoming about child welfare particularly. So those technically based on how the brass codes work, those service codes are eligible, but usually those staff are in like an assessment case based on just my background.
Harry, feel free to chime in if you want to add anything. Otherwise, I'll go to the next question.
The only thing I would probably have to, I mean, they do have to have a signed case plan. And most of the time when you're in an investigation, an assessment, they don't have a signed case plan. So.
Okay.
Yes, and that's something that we will actually be highlighting very soon in this presentation.
All right. And then do you know what the program and service code would be for children's mental health services for youth who are over age 18?
The program and service code, I believe it is 410. It's either 410 or 420. And then instead of using 490 as your service, you would change to 491. So those are some outlying cases where a child will turn 18 and you have to update the service plan and program in SSIS. It helps with the case counts on the targeted and on the TCM CSR report.
The one thing I would add to that is there is legislation change that was back from last year. It will be programmed into SSIS as of 1/1/27. That will change that. But for now, you are correct, Casey, that they need to use the 491 service for the children or the youth over 18, but in a child work group still.
Good, I get to learn something too.
Do text messages count as phone contact?
Nope. Text messages are one of those things, kind of how I think of it is when you send a text message, you really never know if they truly received it. So you got to stick with the same kind of like with a voicemail. You just have to, it has to be a phone call or face to face.
And then there was a follow-up clarification on that. Does it count for adults or is it across the board? It doesn't count
for
text messages. Sorry.
Oh, text messages is across the board isn't accepted.
Okay. All right. Somebody writes in, it is my understanding that the collateral contact must be listed in the service plan, not just any collateral contact. And that's probably referencing when. Go ahead.
I don't have an answer in terms of the collateral contact within the service plan. I would need, that is something I'm unaware of.
Okay. We'll put a pin in that one and circle back to it. Oh, Jolynn, one of our policy experts here at DCYF, said that is correct for CWTCM, that the collateral contact should be in the service plan. Okay.
There you go.
I'm just kind of moving down the line here, so we'll probably answer questions as we move. Then somebody questioned Jolynn, there is nothing in SSIS that checks if the collateral is listed in the service plan before claiming, correct? So this would be a manual check by county staff. And then Jolynn responded, correct, you would need to have collaterals listed in your case. That case plan you are having contact with, such as therapists, schools, chemical dependency providers, and yes, it is a manual check if a county is monitoring these contacts. And then in that same lane, I have also seen that guardians, parents that may count as a contact to produce a claim, or a child to count as a claim, may not produce a contact or claim if the relationship on the work group is not set up correctly. Lots of input here. Have to probably verify that with one of our subject matter experts, so we might have to circle back to that.
Yeah, I would agree there.
And then Jennifer Rose, our children's mental health and adult mental health subject matter or policy expert, did answer that question about program codes. If the youth is age 18 to 21 and has been in a continuous children's mental health work group, you will continue to document in the CMH work group and use Child Rule 79 case management.
Clarification on that, for now, they have to use the adult until
Okay.
1/1/27. Otherwise,
Okay.
it'll error out on their TCM CSR.
Yep. It's one of those, it's not a very common, at least for Stearns, at least. It happens every once in a while.
And then we have to kind of move on here, but there's one final comment here that we might need clarification on. Teams/Zoom meetings should be classified as interactive video, even if it's not for our monthly contact. I wonder if that's a suggestion more than a question.
Yeah, that would make sense.
Okay.
Eric, there's somebody with their hand up for a while
Yep,
too.
and I was
Okay.
waiting to. Okay, allow Mike. All right, Elena, you're up. You can feel free to unmute and ask your question. Elena Lowell, if you have a question, you can unmute. Okay, we'll go ahead and circle back to her, and we'll just we'll move on to the next portion. Oh, I just allowed Elena access, so let me try that again.
I must have hit it by accident. Sorry.
Oh, okay.
I couldn't get it to unmute for some reason.
Did you have a question?
No, I didn't. I must have hit that by accident. Thank you though.
Okay. Yep. All right, moving on to the next portion.
Yes. So we will now be we're on the third ingredient, supplemental eligibility. So we can go to the next slide. So this is a screenshot getting to supplemental healthcare eligibility through a work group. We provide this in the revenue enhancement trainings because case managers go on this route. This is an example of making sure we communicate with case managers in terms they understand. SSIS allows the user the ability to start at multiple starting points, so they take multiple paths but have everyone finish the same goal. Notice there are separate folders for each claim type, CW, mental health, VADD, and Rule 5. We can go to the next slide, please. CW, TCM, supplemental eligibility. Once there's a signed or court-ordered CW TCM service plan, the case manager completes the CW TCM supplemental eligibility section in SSIS. This includes the following: the completion of the CW TCM eligibility screen. This screen includes results of the assessments used to determine if criteria is met and the date this occurred. CW TCM service plan, note the type of signed or court-ordered service plan and enter the date this occurred. This date, once entered, will set a future annual review date. Service plans must be reviewed annually, and the annual review date are updated in the annual review date tab. If the annual review date is overdue, CW TCM time records cannot be claimed until updated and revenue may be missed. You can search General Reports, Healthcare Eligibility, Report by Worker, select Next Month to find cases due for a CW TCM plan review. And this slide kind of goes back to the earlier questions about the investigative staff. At that point, just from discussion, a lot of those workers, a signed plan hasn't been created yet. So that's why some of those entries might not create a claim. And so we can go to the next slide, please. Supplemental eligibility for mental health TCM. Client under 18 must have a serious emotional disturbance, SED, serious mental illness, SMI, in Minnesota statutes eligibility diagnosis. Clients 18 up to 21 can have a serious and persistent mental illness, SPMI eligible, or if they have received continuous mental health TCM service since before turning 18, the client can remain SED eligible up to 21. Adults 21 or older must be SPMI eligible, and then clients must have a written individual support plan based on diagnostic assessment and functional assessment prior to claiming. And just to talk about those plans a little bit more, adults utilize the individual community supports plans, and then the children utilize the individual family community support plan. The case manager must complete a plan, the plan that's necessary within 30 days of the first meeting with the person, and at least every 180 days after the development of the service plan. The case manager will write the plan based on diagnostic assessment and functional assessment, and the interview with the person served and their parents, guardians, or legal representatives. The plan will target the development of resilience, independence, and improved functioning within the person's home and community. We can go to the next slide, please. All right, supplemental eligibility VA DDTCM. Clients must be over 18, be in need of a service coordination to maintain living in an integrated community setting. They must not be receiving community-based waiver services, and client is a vulnerable adult in need of adult protection or an adult with a developmental disability or related condition. Two things I wanted to add about VA TCM was that sometimes clients in this situation may qualify for multiple types of case management, VADDTCM, relocation service coordination, which is abbreviated for RSC, or adult or children's mental health. You are not allowed for dual case management for both VADD and AMHTCM. Or in addition, you are not able to for dual case management for VADD, TCM, and waivers. One thing here at Stearns County, our VADD TCM numbers have significantly dropped over the past 5, 6, 7 years, and just discussing this with management here at Stearns, it was kind of described that the VADD TCM is more of a target case management that is more for people that are okay in their situation, are in needing limited interaction with their caseworker, versus the waiver, which allows for more consistent time with the staff and such, and their needs can be better met utilizing the waiver. So that's one thing that in the past 6, 7 years, we have been able to receive better access to the waiver services, and our VA DDTCM services has decreased. Now we're going to go to the next slide for another roundup for some more questions.
Okay, we just have some follow-up here. Confirming that you said children age 18 to 21 should be claimed as an adult until 1/1 of 27, and Carrie followed up with yes. If you do not pick 491 adult rule 79, it will error out on your agency's counts on the TCM CSR report. One of my colleagues asked if there will be a QA document following up on this. I think we can definitely print out the chat and create something. Emily asks, does the mental health targeted case management supplemental eligibility screen need to be completed one time or updated as the diagnostic assessments are obtained?
It should. From what I recall, it's just entered in once, and it doesn't need to. There isn't a screen for review. I think it's just more manual.
Correct. Yeah, I would say as long as they continue to be eligible, you should be able to. You don't have to fill out a new screen, but I would, if you get a new DA, I would be entering the new DA into the diagnosis screen.
Yep.
All right, thanks. And then Andrew's stating that we might be missing the last criteria for VADD TCM, and it's not receiving home and community-based waiver services, which I did think you covered, but or is an adult who lacks a permanent residence and who has been without a permanent residence for at least 1 year or on at least 4 occasions in the last 3 years. And then he posted the link to the, or not the link, but a screenshot of statute.
I did discuss the not receiving community-based home services.
Yeah.
The permanency, that I definitely did not say anything. So Andrew, I appreciate your help with this.
Yeah, thanks for the input. And then is the billable date for committed clients the date of the commitment rather than the date the plan is signed?
Billable date for I don't.
I would have to
It's
say
just,
it's when the client becomes eligible. And it's usually, most of the time, it's usually the date of assigned plan. So yeah, as
that's
long as you have all that criteria met and there's a signed case plan, that's the date that you would use.
Thanks,
thank you, Carrie.
Casey and Carrie. We do have a contact for our VA DDTCM folks if you have additional follow-up policy questions and we're not meeting the answer. Then I have been told that when a client is on a commitment, it starts on that date. So maybe we need to get some clarification on that.
Yeah, I'd be welcome to get that information too.
I'll try to see if I can reach somebody behind the scenes here as you continue through. Okay.
Awesome, thank you. And we can go
Otherwise,
on to
we can do that QA document and then add the answer to that.
excellent. So now we are on the fourth ingredient of 6, about medical assistance or Minnesota Care eligibility. And we can go to the next slide. So this is just a simple screenshot from SSIS showing the healthcare eligibility from MMIS window, and where you would see the eligibility spans. This is a great place to look, but at the end of the day, when Stearns County does our research for claiming, we do a search for duplicate PMI numbers by client name and date of birth, because SSIS may not have the correct PMI, and that's where this information is pulling. So to get the most accurate information for PMI information, we utilize the MMIS system. At Stearns, the staff accountants who work on the claims do this in order to potentially clean up any edits before they are questioned to a case manager. And we can go to the next slide. So, quick discussion about medical MA and Minnesota Care. So now we're going to talk about diagnosis codes quick. We go to the next slide. The diagnosis codes, their default diagnosis code in SSIS admin for CW TCM is Z60.9 and VADD is 68.9. For mental health TCM case managers, they will enter the diagnosis code related to the SED or SPMI in the person's diagnosis record. So this window can be a little intimidating for a worker because they may enter in a diagnosis code and the diagnosis code may not be specific enough, and an edit will be received. So what we do here is when we notice that a diagnosis code isn't specific enough, we will ask to see if there is a more specific diagnosis code that can be entered, and or if the and or if there's nothing listed, we ask for something to be added in the system. When a diagnosis isn't specific enough, it will create that error, and we just need to just verify that that is the primary and that it's more ICD-10 code specific. SSIS does update the ICD-10 codes but there may be a lag in the current ability when the updated codes from the time the list is released and implemented in SSIS, and the list is usually released every year on October 1st. So diagnosis codes are one of those, there's just based on the situation in the case, you may have to branch out on how you ask your questions to get the right information. We can go to the next slide, please. So here we're just, if there's any new questions, if not, we can move along to the final ingredient.
Okay, so Julie writes regarding that question about commitment. The commitment question can be both. If they are already determined eligible before the commitment, we can continue to bill TCM. Commitment alone is an automatic eligibility qualifier for targeted case management as long as they have billable insurance. So if no prior case management was in place prior to the commitment, then billable start date is the date the commitment order is signed. Appreciate you, Julie. Jody writes, CWTCM case managers need to add minimum entering of Z60.9 code for claiming. Jody, that diagnosis code is automatically in SSIS to create the claim, so there's no need to enter that. And then Cindy follows up, if the client does not have billable insurance and is on a commitment, we still enter them as eligible with no MA. So again, probably we'll follow up with some clarification around that. So thank you, Cindy. And thank you, Julie. And I don't see any additional questions. So we will go ahead and move on to the best ingredients of a chocolate chip cookie claim batch.
Yes, so we finally got to the edible chocolate chips. So this we're just going to quickly discuss the staff provided rates. We can go to the next slide. So this slide right here has a link to partner link, and the box right underneath has a targeted case management rates. That is from the site. So once the rate is updated, they will list the current rates for your county. To my knowledge, the state fiscal year 2027 rates have not been released yet, so those should be coming anytime now. But the other tables on this section is information that would be utilized by the admin users for SSIS on how to update the rates in the system. A tip that was presented would be to put an end date of 6/30 of the following year to be a reminder that the rates need to be updated. So just in case when there's turnover and stuff and someone new to that, you don't run into an issue. You can go to the next slide, please. We'll just go to the next. Yeah. So now, is there any questions about the rate stuff?
I
I'm
can
not sure.
definitely show the website where those are located. They're not out quite yet.
Okay. Yeah, I believe it was early. I believe it was a little after the 4th last year when it was made available.
So this is our partner link website, fiscal reporting and accounting, and somewhere down toward the middle is the targeted case management rates.
Yeah, it looks like they've updated. They're getting ready to update it since they removed
Yeah.
the prior year.
So we don't have the SFY or state fiscal year 2027 up yet, but this is where you would get that information and plug it into that staff provided rates screen, whoever handles admin at your agency. So that you can get reimbursed properly. based on your allocation.
Yep. And PartnerLink is another site that I utilize quite frequently to either double check on an allocation. There's just lots of quality information out there that are helpful for the accounting staff here at Stearns.
All right, somebody wants a batch of cookies when all is said and done here. And I think we can move on.
All right, perfect. We can go then to the next slide. And this next section is about the claim proofing edit report. And then we can go to the next slide where we have I have a screenshot of what our proofing report looks like at Stearns. On this page, there's a link that goes out to our Mikasa blog that from what we had presented in 2024. We utilize electronic files of this document so everyone is working on the same information. So whenever there's an update, we update the system so that everyone's using the same documentation and there's no change. There are several proofing edits listed on our report. They may be incomplete for your agency, but if you add some extra sweeteners, it can work for your agency. In addition, at the end of this presentation, there will be a link to Carrie's CWTCM training PowerPoint. This is a great resource that showcases different proofing edits. And we can go to the next slide.
And the next slide is a video of how to run that claim batch. So just need to make sure I'm sharing my sound. Hello and welcome to this video on claim batch time proofing with advanced grid features. At times, fiscal workers may wish to distribute a report of time proofing to
Your video stopped.
agency. Sorry about that. Case workers to update or fix errors regarding claiming. In this training example, we will show you how to create a claim batch search, use advanced grid features to sort results by worker and print grid, and we'll also show you how to create the report that lists each worker on their own individual page for ease of distribution. The first thing that we're going to do is we're going to navigate up here to searches and logs. And then we're going to navigate down to healthcare claiming. And then over to claim batch search. We're going to use test data in this example. This is a test environment with test clients. Then I'm going to start entering information into my search fields. We're going to start with batch status. When I select the arrow in this field, you'll see I have some options to choose from, but more often than not, we're going to search for draft, batches in draft status. In this example, we're going to use the claim category of CWTCM. And then we're going to use a custom date range, and we're going to go to 01/01 of 2026. And then I'm going to leave the to field blank to leave it open-ended. You can definitely add more search criteria into these other search fields, but once I'm satisfied with my search criteria, I can navigate over here to the right-hand side of the screen and select search. After selecting search, you'll see results populate in grid form in the center of the page, as well as over here in the tree view. We're going to go to May of 2026. And in order to run that time proofing report, I'm going to need to navigate to the time proofing tab. And I'm going to click on that. After selecting the time proofing tab, I'm going to notice that there are some default time proofing categories that show up. with a check mark, and those include time record, attempted contact, duplicate claim, MA eligibility, and supplemental eligibility. If I want separate or to include more time proofing categories, I can simply put a check mark next to those time proofing categories. For this example, I'm simply going to come over here to the right-hand side of the screen and select all. And then I'm going to select search. After selecting all and then selecting search, you'll see that I'm going to yield some results here in my report. And the default settings will sort this report by client, but what I really want to do is I want to sort this by worker, because I want to distribute it to the workers to correct errors or proofing messages. So I could do that in a couple of different ways. I can navigate over here to the worker column and I can right click. And in the advanced grid menu, I can select group by this field, and it's going to pop it up here in the group by box. However, I want to show you a little bit easier way to do that. So I'm going to right click on any one of my columns. I'm going to come down here to grid settings and I'm going to restore everything to defaults. And if I want to sort by worker, I can simply come over here to that worker column and left click and bring it up to the group by box here. And then as you can see, client appears on top above worker. What I really want to do is sort this by worker. So I'm going to grab client name and drag that underneath worker. And now my report is sorted by worker, and underneath the worker are their clients, as well as some errors. I want to show the proofing messages associated with each one of these errors, so I have to do a couple of different things. If I furnished this report, if I printed this grid, it's not really going to help the worker. So I have to do a couple of extra steps to illustrate that. I'm going to right click on any one of these columns. And the first thing that I'm going to do is I'm going to go to expand and collapse. And I want to expand all to show all of that proofing. And then I want to show the messages underneath each one of these proofing. So again, I'm going to click on this clock here. This is a step that you have to do. And then I'm going to navigate up to the grid. And I'm going to go to those advanced grid features again. And I'm going to go to view and select preview. Now you see all of the proofing messages underneath each one of the workers and each one of the clients. So now it looks like I'm ready to go ahead and print grid. So again, I'm going to select any one of these columns and I'm going to select print grid. Now I can go ahead and print this report as it appears. Let's say I want to design this to show individual workers on separate pages, so I can just distribute those single pages to a single worker without them seeing other results. What I have to do is I have to navigate up here to design, and then I'm going to navigate to formatting, and we're going to select top level groups here and select OK. Now this report is going to show individual workers on each page. So when I print this, I can just break it up and send it to each individual worker. All right, people, sorry about that. Sounds like there was some audio difficulty, but every time I tried to answer the question, it would stop playing the video, so I figured I'd just play it through. Sorry about that. We'll work on our audio settings on our side. There's a question about sending this video out. We are in the process of creating a video library. We've just obtained a license to do so. So hopefully we can distribute more of these videos for people to access on demand. But the basis of this video was just to show you how to do that time proofing report based on specific claim batches. And I can see if I can send it out in the meantime, but I'm going to turn it back over to Casey to talk a little bit about Stearns County and how they monitor their targeted case management and match them with their measures and goals.
Thank you, Eric. And one thing I'll just note, I'm gonna put my. I'm hoping everyone can hear me okay. I just put my email in chat. Um, we utilize an Excel for this process instead of a PDF. If you're interested in like some of the default columns and some of the tips, tricks we utilize in this process to kind of do it efficiently and effectively, please just send me an email and just ask for your the Excel directions, and me and my team members we will put something together, and I can send an email out. I'll say by the end of next week, so we have a time for everyone to respond and get everything done with the short holiday week. So, right now I'm going to discuss how accounting and programs work together for efficiency. So, helping case managers save time by cleaning up the proofing reports allows them to focus their time with the clients and clean up the claim, only focus on the claim proofs that make a difference. Emailing the claim proofing edit list every month, including a link to the claim proofing guide, creates buy-in, explaining why we need to fix the proofing edits, and allows us to just kind of keep a schedule of how everything is done and keep kind of have a normal set rotation. Communication is key with case managers. We'll let them know when they are fixing the revenue they're generating. Little things like that, when they realize that they make one or two corrections that takes 5 minutes and they bring in hundreds or even thousands of dollars, is very rewarding. If we don't understand something during the process, we'll ask a question about the terminology used. We all are here to serve people. It's just sometimes just the language you use just a little bit different in like a financial sense versus a social service sense, working with that. So it's just kind of finding the right words to talk about that. And then as everyone learns, we're able to take the proofing edit report and then fix it, um, and make it better just so it suits everyone the best we can. Um, a few other things we strive for is making a rule that in SSIS, any do not claims or exclusions are entered by accounting, and there's always an end date. Um, that helps prevent any lost claims, and just being honest with people, and just if you send an email, we try and set a timeline of 5 business days to hear a response. If we don't get that response, we simply like to respond back to that worker, and then add their supervisor just to check in to see how everything is going. Everyone's just busy with their job and just with everything going on. So sometimes just the email just slips through, and just that little simple reminder is just a good thing. It helps build buy-in, and then it allows for collaboration. We can go to the next slide. So the next 4 slides after this one is how we're going to talk about monitoring performance. We're going to briefly talk about the TCM revenue cash basis, rate history, percentage of cases paid, and our overall general performance measure that we have at Stearns. So we can go to the next slide, please. So this chart showcases from 20 to 25 the revenue that came in for either CWTCM, children's mental health, adult mental health, or VATD TCM. Claiming edits are worked every month on a timely basis, so that we make sure to submit a claiming batch prior to the last DHS payment each month. So for example, for the month of June, we had a submission last week for the payments that come out this week. This assures revenue is coming in every month and helps us create better projections. We can go to the next slide. So tracking your history is part of your sales pitch to create buy-in. This project we started back in 2018. Again, I'm going to talk about how turnover plays a big role with like items such as the SSTS percentage, because when staff leaves, they can't select anything. And then we have to wait until a new staff is brought on, and then the following quarter, they can be added into the time study. Some things to notice here in the top left chart for CWTCM rates, we had a big increase for July 2020, and that was just mainly because of the random moments being selected for CWTCM. And that was shortly after the creation of our rapid response team at Stearns. Then that team allowed case managers to move cases from assessments to closure or case management quickly, and keeping case loads down to help increase rates. The formula used is the monthly case count from the TCM CSR, and the total monthly costs are total staff costs reported on the Social Service Fund and Seeger report, divided by 12 months times the SSTS random moment percentage for each targeted case management. Some of these charts show change increases and decreases, and a lot of those cases could be based on just turnover and staff moving from children's services to adult services, more costs, social service costs, and the just case counts going down overall. So there's lots of variables to be watching for when you try and project this on a yearly basis and to understand why your rate went up and down. We can go to the next slide, please. So our goals of case reimbursed. Overall, this shows our historical data of the cases, percent of cases reimbursed. As you can see, not every type of case management has improved year after year. Factors such as turnover, client needs, and options available for case management have played major roles in these changes. And it's important to remember the percent of cases paid can drastically change over 1 year as claiming is done due to just the 12 months period of a claim being eligible for being submitted for reimbursement. And we can go to the next slide, please. And this slide talks about our target case management performance goal. This performance goal has been submitted with our budget for the past 5 years. 22 numbers were higher due to the public health emergency waiver. And then 2025 ended up being a little lower currently, but this number is still fluid because we're still able to go back and work on some 2025 claims. And just some historical data. In 2017, we had 9,822 cases, and around 50% were reimbursed for revenue of 1.164 million. And in 2023, there was 7,078 cases counted cases, with 61.78% cases being reimbursed for 2.1 million. So we had 2,700 less cases, but there's an additional revenue of 940,000. So it's just because your case counts may decrease, if you're able to increase that percentage, you can make up for that possible revenue. And you can go to the next slide, please. So I'm going to stop sharing that for questions.
So one of our participants, Andrew, put some helpful resources in the chat for folks if they want to navigate to the chat and grab those. They're stating that those links were a really good starting place for him. Then somebody asked a question about proofing messages not falling off of claim proofing reports, and I said it's my understanding that sometimes there are proofing messages that won't fall off, and Carrie followed up with some items will always appear in that claiming batch, but when you create a new claim batch, the errors may drop off depending on the service dates you're pulling in. SSIS will stop looking at older service dates, so those specific errors will no longer appear. So thank you for that clarification. And again, everybody, if you could just give Casey a big round of applause using your emojis. This is a very vulnerable place to be. I really appreciate his partnership, and I want to encourage other people to, if you are a subject matter expert in any area, you can always reach out to me and we can potentially partner on content for a future coffee talk. And also, you can definitely, you don't have to be the speaker, we can work on the content, or you can do like Casey did and just be vulnerable and present information in front of a large audience of almost 300 people. So very good job, Casey. Before we close out today, I do want to go over a couple of resources that we put together. Here's your final cookie. Isn't it beautiful? Getting lots of kudos in the chat, Casey. Thank you so much. So again, navigate to that sentiment and feedback engagement HQ page to get the copy of this presentation, and you'll be able to select any one of the links here. And it will take you to the Minnesota Healthcare Program Manual. We have some physical online on-demand trainings, modules 7 and 8, that are helpful with claiming practice. We have a child welfare targeted case management coffee talk from 2023. We also have an e-learning that one of our e-learning curriculum designers created a couple years ago that's attached on Partner Link, but it's here for your review. And then we also have our physical documentation. And Casey talked a little bit earlier about Harry's CWTCM PowerPoint, and I just wanted to draw your attention to that. Under the healthcare claiming section of our physical documentation, it's right down here at the bottom. And it goes over SSIS and CWTCM, and it contains a lot of those proofing messages that you can check. You can check on and use this as a reference point for that. And then we also have that bulletin that Casey alluded to earlier from 2024 regarding child welfare targeted case management. Yep. Thank you. And then finally, on this last slide, we get a lot of policy questions at the help desk. And one of the reasons why I wanted to put this together is because of that. In terms of our physical tickets, healthcare claiming, as well as the child foster care report, are the biggest high flyers, I would say, in terms of questions. So a lot of those questions do come in and they pertain to policy. So we would prefer that any policy related questions be relayed to the policy experts themselves. So we have policy context for all of the different targeted case management policy experts on this slide. And once again, huge thank you to Casey, huge thank you to Stearns County for letting us borrow him. And a huge thank you to all of you who do this work every day in the gray areas of child welfare and just social service practice in general across the spectrum. Everybody have a great rest of your day.
Yeah, I'll just simply add quick. Overall, this process was very rewarding for me. It's always a great opportunity to be able to take something you've worked years and years of time with, you feel like a subject, you can feel like a subject matter expert, and then present this to people just to help them along. It's very rewarding, and I hope people are able to take away just a few little things, and just something as simple as just trying to collaborate within your teams as best you can just to get that information going. At the end of the day, it's very important to me to make sure you share the information. Your information and knowledge you have doesn't need to be a secret. It's great information to share with everyone. So you might as well work with the same information and just do the very best you can.
Thank you so much, Casey. And thank you to all of the crowdsourcing in the chat today. I really appreciate all of that. Feedback and resources and really good questions. So thank you and have a great rest of your day. Best TCM info in years. All right.
Thank you, everyone.